The manner of death categorizes whether the death was natural, accidental, suicidal, homicidal, or undetermined. Differentiating between these possibilities is critical, especially in cases where foul play is suspected. For instance, forensic examination can help distinguish between a heart attack due to natural disease and asphyxiation caused by external force, which may indicate homicide. Similarly, in suspected drug-related deaths, forensic toxicology can determine whether an overdose was accidental or intentional, aiding in legal proceedings and preventive public health measures. Forensic pathology plays a crucial role in investigating sudden and unexpected deaths, which are defined as deaths occurring within a short period, often within 24 hours of the onset of symptoms, in an individual who appeared healthy or whose death was unanticipated. Such cases present a significant challenge to medical professionals, law enforcement agencies, and legal authorities, as the exact cause of death is not immediately apparent. Forensic pathologists conduct autopsies, histopathological examinations, and toxicology tests to determine whether the death was due to natural causes, trauma, poisoning, or criminal activity. Sudden deaths can result from a variety of medical conditions, with cardiovascular diseases being the most common natural cause, particularly in adults. Other causes include neurological conditions like strokes and seizures, respiratory disorders, metabolic imbalances, and infections. However, not all sudden deaths are natural. Many may result from homicide, suicide, accidents, or drug overdoses, making a thorough forensic investigation essential. In addition to medical and scientific aspects, forensic pathology has profound legal and social implications. The findings from a post-mortem examination can help in criminal investigations, insurance claims, and public health interventions. By establishing the precise cause, manner, and mechanism of death, forensic pathologists contribute significantly to the justice system, healthcare improvements, and the prevention of future deaths through identifying trends and risk factors. The importance of forensic pathology in sudden death cases cannot be overstated, as it provides critical insights that serve both scientific and judicial purposes. Importance in sudden death investigations: cause, manner, and time of death. Forensic pathology plays a vital role in sudden death investigations, as it helps determine the cause, manner, and time of death, which are crucial for legal, medical, and public health purposes. Establishing the cause of death involves identifying the underlying medical condition, injury, or external factor responsible for the fatal outcome. This could range from natural causes like cardiac arrest, stroke, or pulmonary embolism to non-natural causes such as homicide, drug overdose, or accidental trauma. A precise determination of the cause provides clarity for families, law enforcement agencies, and the judicial system, helping to resolve uncertainties surrounding the death. The manner of death categorizes whether the death was natural, accidental, suicidal, homicidal, or undetermined. Differentiating between these possibilities is critical, especially in cases where foul play is suspected. For instance, forensic examination can help distinguish between a heart attack due to natural disease and asphyxiation caused by external force, which may indicate homicide. Similarly, in suspected drug-related deaths, forensic toxicology can determine whether an overdose was accidental or intentional, aiding in legal proceedings and preventive public health measures. Determining the time of death is equally significant, as it can corroborate or challenge witness statements, provide investigative leads, and establish timelines in criminal cases. Pathologists use multiple scientific indicators such as rigor mortis, stiffening of muscles, livor mortis, post-mortem lividity, body temperature, and decomposition changes to estimate the approximate time of death. Advanced techniques, including entomological studies, examining insect activity, and biochemical analysis, further refine the estimation in cases of prolonged post-mortem intervals. Overall, forensic pathology serves as a foundation for accurate, objective, and scientific investigations into sudden deaths. By meticulously analyzing the cause, manner, and time of death, forensic experts provide essential evidence that aids in criminal justice, insurance claims, medical research, and public health interventions, ensuring both truth and accountability in cases of unexpected fatalities. Common causes of sudden natural death. Sudden natural death occurs due to internal medical conditions rather than external trauma or violence. The three most common causes include cardiovascular diseases, neurological conditions, and pulmonary embolism. 1. Cardiovascular diseases, heart-related causes. Cardiovascular conditions account for the majority of sudden natural deaths, especially in adults. The most frequent culprits include myocardial infarction. Heart attack, a sudden blockage in the coronary arteries restricts blood flow to the heart, leading to fatal arrhythmias. Cardiac arrhythmias, irregular heart rhythms, such as ventricular fibrillation, can cause immediate collapse. Hypertrophic cardiomyopathy, a genetic heart muscle disorder that can cause sudden cardiac arrest, especially in young individuals. Aortic dissection, a tear in the aorta's inner wall leads to severe internal bleeding and sudden death. 2. Neurological conditions, brain-related causes. Sudden death can also occur due to acute neurological events, particularly those affecting the brain's blood supply and function. Intracranial hemorrhage, stroke, a ruptured blood vessel in the brain, e.g. aneurysm rupture, can cause rapid brain damage and death. Epileptic seizures, SUDEP, sudden unexpected death in epilepsy, uncontrolled seizures, can lead to respiratory failure or fatal cardiac arrhythmias. Brainstem infarction, damage to the brainstem, which controls vital functions like breathing and heartbeat, can be instantly fatal. 3. Pulmonary embolism, blood clot in the lungs. Pulmonary embolism (P) is a life-threatening condition in which a blood clot thrombus travels to the lungs, blocking the pulmonary arteries and preventing oxygen exchange. This can lead to sudden cardiovascular collapse and death. Key causes include deep vein thrombosis. DVT blood clots originating in the legs or pelvis can dislodge and travel to the lungs. Prolonged immobility. Long flights, surgery, or bed rest increase the risk of clot formation. Hypercoagulable states. Conditions like cancer, pregnancy, or genetic clotting disorders increase the risk. Post-surgical complications. Major surgeries, especially orthopedic or abdominal procedures, can increase clot formation. Pulmonary embolism often presents with sudden shortness of breath, chest pain, and collapse, and in many cases, it is only diagnosed post-mortem during a forensic autopsy. These three conditions, cardiovascular disease, neurological events, and pulmonary embolism, are the leading causes of sudden natural death, often occurring with little or no warning, making forensic investigation essential for accurate diagnosis. Challenges in determining the cause of sudden death. Determining the exact cause of sudden death can be an intricate and challenging task for forensic pathologists. Several factors complicate the investigation, including a lack of medical history, decomposed bodies, and limited evidence. These challenges can hinder the pathologist's ability to provide a definitive cause of death and may require additional investigative methods to reach an accurate conclusion. 1. Lack of medical history. One of the most significant challenges in determining the cause of sudden death is the absence of a detailed medical history. Many sudden deaths occur in individuals who appear to be in good health or had no known pre-existing conditions. Without access to medical records or knowledge of the decedent's health history, forensic pathologists have limited insight into potential underlying conditions like cardiovascular disease, genetic disorders, or metabolic imbalances that might have contributed to the death. For instance, conditions like hypertrophic cardiomyopathy or epileptic seizures can lead to sudden death, but without prior diagnosis or awareness of symptoms, identifying such causes becomes more difficult. Additionally, the lack of medical history may lead to misdiagnosis or undetermined causes, making it a major obstacle in forensic investigations. 2. Decomposed bodies. When a body is found in an advanced state of decomposition, it poses a significant challenge for forensic pathologists. As the body breaks down, post-mortem changes such as putrefaction, insect activity, and tissue breakdown can obscure the original physical signs that would indicate the cause of death. For example, In the case of cardiac arrest or myocardial infarction, the heart tissue may decompose to the point where it is no longer possible to visually examine it for signs of damage or blockage. Similarly, blood clots or trauma-related injuries may be difficult to detect as tissues decay, and key evidence can be lost. In such cases, forensic pathologists rely heavily on toxicology tests, entomology, insect activity analysis, and other specialized techniques to help estimate the time of death and gather information about possible causes. However, the inability to perform a complete autopsy on a well-preserved body can lead to inconclusive results. 3. Limited evidence. In many sudden death cases, there may be limited physical evidence available for analysis. This can be due to several factors, including the absence of visible injuries, the nature of the death, e.g., cardiac arrhythmias or strokes, or the lack of environmental clues that might suggest foul play, such as in the case of natural deaths. When a death occurs due to an internal medical condition, such as myocardial infarction, there may be little external evidence to indicate the cause, making it difficult for forensic pathologists to make a determination. Additionally, in cases where the individual had no known history of disease, the absence of external injuries or other obvious signs of trauma can lead to uncertainty regarding whether the death was truly natural or if foul play was involved. Toxicology and histopathological analysis may be needed to identify underlying conditions or substances, but even these tests are not always definitive, especially if limited samples are available for testing. Overall, while forensic pathology is essential in determining the cause of sudden death, these challenges highlight the complexities involved. In such cases, forensic pathologists must rely on a variety of techniques, advanced diagnostic tools, and collaboration with other experts to piece together the available evidence and provide the most accurate conclusion possible. A forensic pathologist is a medical doctor who specializes in determining the cause of death by examining a deceased person's body. This role is crucial in the criminal justice system and involves performing autopsies, interpreting medical histories, and conducting scientific tests to provide insight into how and why someone died. Here's a breakdown of their key responsibilities. 1. Autopsy. An autopsy is a systematic and detailed post-mortem examination of the body to establish the cause of death and determine any contributing factors. Forensic pathologists perform autopsies in cases of sudden, unexpected, or suspicious deaths. The procedure typically involves external examination. The body is inspected for signs of external trauma, such as bruises, cuts, burns, or gunshot wounds. The pathologist also notes identifying marks, such as tattoos or scars. Internal examination. The internal organs are examined for any abnormal conditions, such as disease, infections, or injuries. The organs are weighed, measured, and dissected to identify any pathological changes. Documentation. The forensic pathologist documents all findings meticulously, including photographs and written descriptions, to ensure accurate records of the condition of the body. Toxicology. Samples of bodily fluids, including blood and urine, are collected for analysis to detect the presence of drugs, alcohol, poisons, or toxins. An autopsy helps to clarify the cause of death, the direct injury or disease leading to death, and manner of death, e.g., homicide, suicide, accidental, or natural. 2. Microscopic examination. The microscopic examination involves analyzing tissue samples under a microscope to detect subtle or microscopic injuries that may not be visible during a routine examination. This is a crucial aspect of forensic pathology because it can reveal hidden trauma, infections, or disease processes that contributed to death. Steps involved in the microscopic examination include tissue sampling. During the autopsy, small pieces of tissue from various organs, heart, lungs, liver, kidneys, etc., are collected for microscopic analysis. These samples are then preserved and processed in a laboratory. Histology. The tissues are stained and examined for signs of disease, infections, cellular abnormalities, or any injury that would not be visible to the naked eye. For example, Microscopic evidence of hemorrhage, cancer cells, or signs of poisoning may be found this way. Injury analysis. Forensic pathologists can identify microscopic injuries, such as tears in blood vessels, tissue necrosis, cell death, or signs of chronic conditions, e.g. arteriosclerosis, that may have led to the death. Microbial infections, bacterial, viral, or fungal infections that may not have been apparent on external examination, can also be identified through microscopic examination, helping establish if an infection contributed to the cause of death. 3. Evidence collection. Evidence collection is a critical step in forensic pathology, as it ensures that all relevant biological, physical, and chemical evidence is preserved and documented properly for further analysis or use in legal proceedings. Key components of evidence collection include biological samples. Blood, urine, saliva, and other fluids are collected for toxicological testing, which may reveal the presence of drugs, alcohol, or poisons. Tissue samples from organs are also collected for histopathological analysis. Physical evidence. Items such as bullets, trace materials e.g. hair, fibers, or foreign objects that may have contributed to the cause of death are collected. For example, if a victim was shot, the forensic pathologist will collect bullets or bullet fragments from the body. Swabs. Swabs of the victim's mouth, genitalia, and under fingernails can be taken for DNA analysis or to detect signs of assault. They can also help in identifying perpetrators if there is any foreign material found on the body. Documentation. Every piece of evidence collected is carefully labeled, photographed, and documented in a chain of custody to ensure its integrity and authenticity in legal settings. Proper handling of evidence is essential to avoid contamination or loss. The evidence collected during an autopsy can be crucial for law enforcement and criminal investigations, as it provides tangible proof that can link a suspect to the crime or confirm the cause of death. Together, these three aspects of forensic pathology, autopsy, microscopic examination, and evidence collection, are fundamental to uncovering the truth behind a death, assisting in criminal investigations, and providing accurate, reliable findings in a court of law.